This is a contrast-enhanced CT brain, and what you can see on the screen is a huge tumor, a huge lesion with a hypo-dense material inside, and showing a post-contrast enhancement in the peripheral area. So this tumor is having a cystic component probably, and is filled with cystic component, and is showing a capsule which is showing a good amount of post-contrast enhancement. That's the coronal view. That's the Sylvian fissure. That's the third ventricle there. The tumor is actually compressed into the third ventricle from below above. And you can see the peripheral enhancement very clearly on the coronal view, and the relation with the posterior circulation as well, the basilar and the posterior cerebral artery. Now, this is a sagittal scan of the contrast CT. You can see a beautiful picture of the entire anterior cerebral circulation with the relationship of the tumor occupying the sellar, mostly the suprasellar area, and you can see that's the contrast enhancement in the capsule area. Now, this is a plain scan coronal view. Here there is no contrast, but still you are able to appreciate a few areas of hyperdensities. These could be either acute bleed or it could be a calcification. This is probably a calcification area. So this tumor is having cystic component, huge suprasellar area tumor, and showing calcifications on plain scan, mostly in the peripheral area. This has to be a craniopharyngioma case.